Good morning, everyone. Today, we will learn something about medical records. So, medical records are maintained in almost all the hospitals, and it is a record which is used as clinical, scientific, administrative, and legal document. So, in this records, the doctors they will write all the all the things about the diagnosis, treatment, and results, whatever they have done on the patients. So it will be written in the form of the sequence. They will follow the sequence in which the diagnosis, treatment, and the results were done. So this is a record which is useful both to the hospital, patients, as well as the doctors. The main purpose of medical record is to say the health history of the patients, their present illness, the past illness, as well as the treatment prescribed by the doctors. So whatever data is given, it will be accurately and it will be sufficiently mentioned in the medical records. There are two general uses of medical records. One is personal, the other one is impersonal. Under personal use, the medical records may be used in order to claim money from the LIC policies, and under impersonal use, we can use the medical records to do research, and in this sense, we have to get the consent of the patients. The other uses of the medical records are, number one is patient care management. Whenever the patient switches from one doctor to another or else from one hospital to another, they need medical records in order to continue their treatment. The next comes quality review. So the hospital or the management may use the medical records in order to find out whether complete care were given to the patients. Number three is financial reimbursement. Again, you can use medical records and you can claim money from the LIC policies. Number four is legal affairs. So the medical records protects the legal affairs of patients, physicians, as well as the hospitals. So whenever the patient gets wrong treatment from the doctors or from the hospital, they can sue the hospital or the doctors, and this medical records, it acts as a proof. Number five is education. So almost the medical records serves as the case study for the students. So the students who are doing medicine can use this case study and they can do their studies as well as research. Number six is research work. So the research work again, you can carry out your research work with the help of the medical records. And number seven is the public health. If you want to find out the infectious diseases pertaining to a particular area or a particular period, this medical record is of much help. Then comes planning and marketing. If you want to improve or if you want to promote the different services of the hospital, again the medical records are useful.